Thank you, Larry, and good morning, everybody. I just wanted to start by thanking the Global Health Institute for organizing this event and for inviting me here. It's really a privilege and a pleasure to be with esteemed colleagues and talking about a subject near and dear to my heart. In talking about non-traditional surveillance, I'm very much going to build on what Dennis Carroll on the last panel was talking about and so eloquently laid out, but I'm going to go a little bit more into depth in terms of how we understand and think about how epidemics begin. And so before I get to a very non-traditional and new surveillance paradigm, I wanted to just start with explaining a little primer on how so many of these diseases, particularly the pathogens that Tony Fauci mentioned this morning, have been popping up more and more in the past decades. We're actually seeing an acceleration of emerging disease events. And many of you in here may have heard this before, but not only do the majority, just over half of the diseases that we know about, we humans have, not only are more than half of them originating from animals, but when we think about emerging infectious diseases, these new viruses that tend to pop up, like Ebola or SARS or Middle East respiratory syndrome, about 3/4 of those emerge from animals, and not just animals, but wild animals. So these viruses are out there circulating in wildlife reservoirs in different parts of the world, all over the world. And so it's just a matter of understanding what's out there in nature and how they're making their way from those wild animals into livestock and people. And if there's one thing I want to impress on you more than anything else, is that the number one driver, the number one cause for all of these epidemics that we have been seeing and will continue to see is us. Human activities, us altering the environment around us in ways that bring us and our livestock into closer contact with wildlife, is the number one driver of emerging diseases. It's causing spillover. So it isn't that the wildlife are carrying these viruses, many of which are perfectly benign in their natural reservoir. It's that we are doing things to precipitate spillover, precipitate encounters with these animals that are leading to epidemics of things we haven't even seen before. So I put this diagram up here to really think about, very simply, 3 stages of emergence. And starting there at the bottom is wild animals coming into contact with our livestock and us through activities such as agricultural expansion, building large farms next to forested areas, urbanization, deforestation, things that put us into new environments where we haven't been before, expanding the human footprint, global travel and trade, bringing us and our animals around the world with us. All of these things lead to this kind of interface between us, our livestock, and wildlife, and allow for these microbes to make their way from their natural hosts into a cow or a person. Now, once that happens, more often than not, probably there isn't any great disease or outbreak that occurs. We're not really sure. But every once in a while, you do see epidemics in human populations, this second stage, where you have a spillover event and a flare-up of disease. And a great illustration of this would be when it happens in a remote human population, like classically with Ebola outbreaks pre-2014, where you would have an isolated population, a village in Central Africa that perhaps got exposed to Ebola by hunting and consuming a gorilla or chimpanzee that had gotten infected and died from Ebola, presumably from a bat reservoir. That gorilla is brought into the village and consumed. You have an Ebola outbreak in that village, and let's say if 100 people are there, 80% of them die, 20% recover, and then the virus flames out because there aren't more people to infect. That's great when you have an isolated population, but then when that population is no longer isolated but is connected, which is what we saw in 2014, where a remote village got an Ebola infection and then people moved into 3 different countries, and Ebola cases made their way to urban centers for the first time, and then we had 28,000 cases and 11,000 deaths. And that's when you get your big, localized, critical epidemics that Mike Osterholm was talking about earlier. And then it's just a matter of getting on airplanes and moving globally to convert a localized epidemic into a pandemic. And so this is really just different points on a time scale. And if our concern and our interest is preventing these zoonotic viruses from ever making their way out of the wildlife reservoirs in the first place, then we need to focus our surveillance efforts and our preventive interventions at that very first stage, those initial interfaces where we make contact with wildlife and allow spillovers to occur. Now, over the past decade or so, the science has gotten a lot more sophisticated in terms of our understanding of where these phenomena are likely to occur. Where in the world are we most likely to see spillover from wildlife into livestock or people? And so this is an emerging disease hotspot map that looks at data like human demography, livestock intensity, biodiversity of wildlife, and looks at things that are dynamic, like land use change. Changing landscapes are accountable for driving about 30% of emerging epidemics. That's deforestation, that's conversion of land to agriculture, or even reforestation, things that alter ecosystems and change the dynamic and the balance between how people and animals interact. So we're getting a better understanding of the where emerging diseases are likely to occur, which helps us focus our surveillance. We're even getting a better understanding of the what and where from. Most of these emerging epidemics we talk about, SARS, influenza, HIV, MERS, they're viruses, zoonotic viruses, and they tend to be RNA viruses. And why are viruses so important in terms of epidemics? A couple reasons. One, they're so mutable, they evolve and change so quickly. Many of these viruses are not only good at infecting multiple species, multiple types of hosts, that given the opportunity to get out of their natural host and into a new one, they can take that opportunity and cause infection. They're also good at evading immune systems and adapting to new physiologies and new immune systems. So viruses have a propensity to make their way into multiple different species. And of course, when it's a new immune system is often when you get disease. And we know that there are certain groups of wild animals that are more important than others in terms of likelihood of hosting known and new zoonotic viruses. Bats, which are the second most diverse group of mammals on the planet, second only to rodents, are actually the single most important group of animals in terms of hosting zoonotic viruses statistically. Rodents and non-human primates are also incredibly important. And what's common about all three of these categories of animals, particularly bats and rodents, is they live everywhere people do, on all 6 continents. So we have a tremendous amount of opportunity to have interactions with bats and rodents, either directly or through our livestock or through contaminated food resources. Migratory waterfowl, of course, are hosts for all the influenza viruses that we worry about. So together, these groups of wildlife not only represent a tremendous amount of diversity in terms of species, but also in terms of viral diversity. And so if we want to start to understand not only where the viruses we know about are coming from, but what else is out there that might threaten public health or livestock health, we have to start to get a better idea of the diversity of viruses that come along with the diversity of hosts. And maybe even most importantly, we're really starting to get a good understanding about how these epidemics occur. And again, as I mentioned, deforestation and land use change is such an important driver for spillover. Right? These wild animals have been living in intact ecosystems for a long time, and whether or not there was pathogen exchange among animals was one thing, but as soon as humans start interfering and we make our way into forested areas we didn't encounter before, we're creating opportunities for spillover. And the growing human population that we talked about earlier is just putting tremendously increasing pressure on environments around the world and creating more opportunity for spillover. So this non-traditional surveillance effort, and it'll be very apparent that I've been working with Dennis for the past 10 years, has been under the Emerging Pandemic Threats Program that USAID has funded, which is active in 30 different countries around the world, emerging disease hotspots, building capacity essentially to create an early warning system, increasing countries' abilities to detect and diagnose not only known but novel viruses, and also to build a workforce that is capable of conducting surveillance in wild animals. That's something that has virtually never happened historically in public health. But to get out there and look at wild animals that we have a lot of contact with and ask questions about what viruses are there, which helps us respond more effectively when an outbreak does occur. It helps to know where that virus has come from, and also helps develop intervention strategies to help people deal with how they live with wildlife. And this is an example of just a book we created about living safely with bats to illustrate the point that it's not going to work to try to eliminate sources of viruses like wildlife. They're too critically important ecologically. We just have to be smarter about how we live with animals in nature and protect the integrity of ecosystems that we live in. And that's going to ultimately protect our health. So it helps us develop interventions to understand the spectrum of what's out there. And of course, understanding the genetic diversity of viruses helps us understand a bit better how some viruses behave in terms of causing disease, while other related viruses may not cause disease. For example, within the Ebola group, we have Zaire virus, which is incredibly pathogenic, and we have Reston virus, which doesn't appear to cause disease in people, two closely related Ebola viruses. So just to finish up, in terms of surveillance effort, understanding, one, what's out there in nature that could potentially be the next HIV is really important if we want to protect ourselves against it and start to develop countermeasures. But two, understanding how we are creating contact with animals that creates risk and working to mitigate that risk by changing behavior is also going to be tremendously important. And we're getting to that by focusing on wildlife and animals and our interaction with them. Thank you.